Hello, everyone. It's another your fertility specialist. I'm your host today. I'm Ruth Ugogo, and I'm excited to be with you on this session today. Yeah, it's Friday. Right now, as we're about starting, call up someone, share this link with someone. Make sure you notify as many as you can because today we're talking about life experiences, real experiences of people that have gone through fertility hurdles and eventually achieved their dreams of being parents. So, this is to encourage someone, this is to light up someone and um, enlighten them so they know that all hope is not lost. No matter how much you've tried, there's still hope. There's something that can still be done differently. And to discuss the story with us today, we have Dr. Deborah Olubiyi. Dr. Deborah, it's good to have you. You're welcome.
Thank you very much. It's always a pleasure to be here. Good afternoon, viewers.
Okay, so dear viewers, as we started, please sit back, enjoy the show, send your questions, your comments to the comment section. We'll definitely attend to them appropriately. Once again, call up someone right now, share this link, and yes, we would not forget to thank you guys for always staying glued to your screen. Thank you for always liking our posts. Thank you for always engaging us. Thank you for always staying tuned. A lot of you are looking forward to our notifications from our different handles just to get connected just for you, and we are glad to have you guys stay tuned. Thank you so much. So yes, let's talk about the testimonial for today. Well, lest I forget, someone might be wondering who Dr. Deborah is. For the sake of someone watching for the first time, Dr. Deborah is a family physician, so all your family members can come and see us. You're not really fine. That's just on a lighter note. She's a family physician. She's a fertility specialist, an IVF specialist. So yes, we're talking about some issues relating to IVF today. So she's the best person to deal with this testimonial today. And she's also the IVF coordinator at Alps Hospitals. Wow, it's good to have you once again, Dr. Deborah.
Thank you very much.
So viewers, let's dive into the topic or share the testimonial of today. Like they would say, well, let me not talk about how they say it in church. Let's get to the business of today. So it reads, I would, as much as possible, try to cut in some parts that I deem not necessary to talk about. She said, well, this is just a part that she said. She said, when time says no and hope says try again. Yes, a lot of times time is time seems not to be on your side, and
Yeah.
then it's hope that you really have that makes you want to keep
Trying, keep
trying and
going
all of
on.
so she said, I'm Mojisola. I married my husband Daniel. That's okay. When I was 22, young. I mean, that was quite young too.
Young, yeah.
She said, young, optimistic, and certain that motherhood would come naturally, easily, and soon. I mean, as a matter of fact, that young, you would not assume that there should be any issue.
Definitely. You won't assume there's an
How,
issue.
well, this is me just worrying. This is me just wondering. In her case, she said she married at 22. So I would wonder for someone that married at 22 and maybe that they should really look out for at that age that will make them worry that okay, it's possible because she would just assume that I'm fine. Any there's red flag that maybe a young lady should see that should make her think maybe
Think
you
that
should
there's a
think in the line
problem.
of yes that
Yeah,
is
22 is
possible.
still very,
Mm,
someone marrying at age, for some people, they would even want to take some years out, before they start trying for pregnancy. Well, red flags might be maybe she's not seeing her period at all, and she did a
mm,
pregnancy test and it's negative, you know,
mm,
and except they've tried, for a year, having regular
yeah,
intercourse for a year, and pregnancy is not happening. Yeah,
yeah.
I think those are the main red flags. Yes.
Okay, so she said she imagined it all. I mean, she talked about her imagination, a house full of toys, but I mean, she's still young, so
I wonder.
all the fantasies of having kids,
She must really
bedtime
want
stories,
children at that
and
age. She's
yeah,
already
tiny
fantasizing.
socks disappearing in the laundry. I mean, a lot. Having to look for one leg of shoe,
Use
one leg. The way
socks.
mothers lost their babies meeting, you see this
for
one, yeah,
one
you not see
for
the
one
other one.
hand of
Oh
everything.
yeah,
One.
she really had her fantasies, but she said life had other plans. She said the first year passed, and then the second soon, and then 14 years had definitely slipped. Wow, 14 years. That's a lot.
Yeah,
22 years,
that's a
14
lot.
years.
Someone that married at 20, 14
Yeah.
whole years.
Wow,
So
wow,
what were they
wow.
doing
I can
within this
imagine,
14
like,
years?
yeah,
Like I said, 1 year, and then after
yes,
that, you should want to know what is.
all that a bit, because this is more like for her to not have achieved pregnancy within 14 years. I'm wondering what she really did. Like you said,
Yeah,
what was she doing at that point? Maybe they can, they'll say everything is
yeah,
fine. I
but we don't
mean,
know if she checked.
she
They should
didn't,
definitely think.
exactly, because for them
Exactly.
to have been
Yes.
waiting, just maybe she
Yes. The
didn't
details
that
of that,
detail,
what
but
they did. But
apparently
I'm
they
just assuming. Some people. I'm just assuming like it's common in our environment. People just keep hoping on God and just waiting and waiting and waiting. Thank God she married early. Imagine someone that married in her
yes.
30s and then you're waiting for 14 years.
Kai, that's a
So that would
lot.
have been too long. But she just had maybe the age advantage. She married early, but waiting
Early.
for 14 years is too
That was a
much.
lot,
Yeah.
actually.
Yeah.
So she said years passed with pregnancy test. I mean, yes, she said yes, fill the pregnancy test. Apparently, she'll keep hoping that they
Uh,
won't see period.
Yeah.
And then,
And be
and
really
and
frustrating.
yeah, I can imagine 14 years.
Yes.
Well, that was a lot. Well, you know what's your counsel to people in their waiting period, people that probably got married and then for some time they've been trying to conceive? What's your counsel to them? Because some of them, just like you said, just stay
Keep
back.
waiting
What
and
should they be
waiting.
doing in this period while they are trying to conceive, or the
So
period
the
where they are
yes. So the logical to think said at this age, after trying for 1 year, your husband that they're having
yeah.
regular intercourse 3 or more times in a week, and pregnancy is not happening, you should go for a medical evaluation to know what could be
Mm,
wrong. That's just the logical thing to
to
do.
do
Yes, so I'm surprised 14 whole years went by.
past
What did they seek medical attention,
and
or
all of
maybe
that.
they went to the wrong places, or what exactly was
Did
done?
they do?
Waiting for 14 years, did they know? No, like I said, she was lucky. She had age on her side. Imagine
Mm,
someone marrying her late 20s or marrying her early 30s.
yes.
You add 14 years to
To
that,
it,
they're in
exactly.
their 40s,
Hi.
and we know that ovarian function, start deteriorating for about 35 years
The
of age.
page.
So,
Wow.
yeah, waiting that long is too long, you know, it's too
So
long to wait.
I'm presuming
So,
that,
what hoping and trusting in God, you should
yeah,
seek medical help. That's
help.
what I counsel. You should seek,
So
yes.
for dear viewers, well, this is worrisome that she stayed for 14 years. I believe
Yes.
she
And a
tried
lot of
because
people do it because
hmm,
we see people in our clinics 18 years. You ask, Madam, sir, what have you done? What have you gone to the hospital? What were you told? No, we've not. You'll be
Thai,
wondering. 18 long years, 20 long years, 22
Thai,
years,
Thai.
you know, no medical help sought. I don't think that's
It's
correct.
sad. It's sad. And
Yes.
sometimes, the thing is, sometimes they even go to places and knowing that she's young, they'll say,
Yeah, go and relax.
maybe they've told her that
Yes.
her tubes are fine. They've told her maybe the patency, and they say, your husband's sperm is not bad. And then maybe they just stayed and they are trying.
Yeah,
We know that
because
sometimes some of these things, they can be unexplained, and maybe they just keep
unexplained
telling, maybe they are not
infertility,
able
and
to
then
pick
some of these
anything.
places they go to are not specialists in this field, so
Mm,
they just do the basic test.
yeah.
Those tests that will really help to bring up a diagnosis, they are not done.
Mm,
So most people, they just do a scan, maybe tell you go and do an HSG, maybe do
mm.
the seminal fluid analysis,
And
and
then
that's
they
all. But there
say,
are deeper
yes, it's
investigations
to
to
be
do.
done.
Yes, and
Those.
yes.
So please, you shouldn't wait for long. Even if somebody, if people are, even if you're seeing a particular physician, that everything is
It's
fine.
fine, and pregnancy
Please
is still
have
not
that
happening.
unrest and look for
Yes.
help elsewhere. Don't just stay and keep sticking to it's fine, everything is fine.
Yeah.
But pregnancy is not happening. So it means everything is not fine. Yes, it might look like, I know that sometimes you cannot rule out the spiritual or whatever it is that
Yeah.
people add in quotes, but sometimes these things too are things that could actually be added
Yeah, I think that
with
it just brings to mind a case of a man low sperm count, and they were going to
Okay.
this hospital for 10 years.
Hmm.
They will keep going. After a few months, the man will do this seminal fluid
Yes.
analysis, still placing on the supplements.
Oh
For
my
10 whole years,
goodness.
they were going to
10
this same
years.
facility. And the
Kai.
cause, and then look at the woman aging.
Oh my
The woman
lord.
is aging.
Wow.
By the
Wow.
time they came to us, the woman didn't have eggs any longer. Imagine 10
Hmm.
whole years when the
So
proper
sad.
intervention could have been done. It wasn't done. And I don't know, even if a doctor is keeping you to his clinic, but you see that every month you're going, it's the same
It's
thing. Nothing
exactly.
new is being introduced. So you don't expect a different outcome. So
Yeah.
people should also learn to think for
For
themselves. And in
themselves.
this day and
True.
age, which Google is there, social media there, where you
Mm-mm.
can get information that
Yes.
could
That's
help you,
right.
even if the people that should tell you the right
And not
information are
forthcoming
not
with.
telling you the right
Hmm.
information. Yes.
So she said, well, heartbreaks, doctor's appointments, and loneliness that only someone trying to
Mm.
conceive can truly understand. Yes, they really say until you're in the shoe, you really
Yeah.
cannot, you can't tell what is. In fact, there are some people that even within a year, the kind of tension they have to
They
deal
put
with,
themselves through.
yes, when they are not able to
Yeah.
achieve, and
Some.
then having to wait for that long, I can really imagine what Moji had to actually deal with for
Yeah.
those years of waiting. She said, um, she said, when I turned 36, one truth began weighing heavily on my mind. Age was no longer on my side. Now, wow, 22 years of
So
my wow.
36.
She said she had read enough to know that after age 35, a woman's ovarian reserve
Okay.
declines. So she said when eventually she went like eventually I think they sought and she said so hearing it from her doctor aside what she eventually heard it from her doctor, it hit her differently. Like, okay,
Yeah. Time is really going.
yes. So she said, well, in the course of, I think they were still making their findings. Apparently, from the look of things, I think she didn't just want to give so much details of what they
Okay.
had
Done
to
prior. Okay. So they had approached
go
a
through.
health
Yes,
person.
yeah,
Yes.
had done some approaches to see doctors and all, and some of
Okay.
them had already. It's like maybe from the investigation, some of them have started saying that okay, ovarian reserve had declined. So she said, well, with everything, she said she did a Google search of some of the best fertility clinics in Nigeria, and that led her to the halls of Alps hospitals. Oh wow! So Google referred.
Yeah.
Wow,
We have
that's
a lot of
lovely.
clients coming in from a simple
That's
search on Google.
wow. That's
Yeah.
nice. So she said she came. So after careful, that's after okay, that's more like she actually found her way to get to Alps
Okay.
hospitals, and eventually she was seen by the doctor. So she did some investigations. This is me giving some summary because I can see she wrote a lot about what they had to do. So she did some investigation. Yes, one of the pointer was that her air quality had declined significantly. So she said this the doctor had told her, she said due to her age, she said the word those heavy. That's me
Mm.
now quoting what she said. She said, like stones dropping one by one.
Mm.
The doctor continued gently, said, I know this is difficult to hear, but with your levels and age related decline, success rate at this age is not in the is not very high, but it's not as if she cannot achieve success, but the success rate is a bit low. Well, at that point at 36, it still
It's
felt
still
like maybe
good.
she could try.
Yeah.
So she went ahead to give it a try.
Okay.
She decided that she wanted to still try with her eggs, knowing that she wanted to try an IVF. So she went ahead and said, okay, she just wants to still give it a try. She can't come
Okay.
to terms with the fact that she would not use her own eggs and
Mm.
all that. Because yes, even though the doctor had told her that yes, she could still use
Yeah.
her egg, but chances
A
considering
bit
the
lower.
results, because there are some
Yeah.
people at that age, maybe their results might still be a bit friendly. But in
Yes.
her own case, he
Mm.
had told her that her levels were actually low.
Low. Showed declined
Yes,
ovarian reserve.
exactly.
Yeah.
So, but she still wanted to, I think, give
Try.
herself the benefit of that. So eventually she did that, and sadly, the IVF treatment failed for
Oh.
her,
Oh.
which was a very sad one. So now
Yeah.
another time has passed again. Now she's like within this period of 36, it has
Yeah. So
failed.
so let's about that. Diminished ovarian reserve, low
Yeah.
ovarian reserve. Yes, we know one of the common causes is age related. With
Mm.
advanced age, ovarian
Yeah.
reserve declines, and that's why women go into what we call menopause when
Yes.
ovarian reserve comes to total end. Ovarian
Yes.
function comes to a total end, and the ovaries are no longer producing eggs.
Functional.
But before you get there, there's a
It's
period
gradual.
when there's a mark from about 35 years of age, there's a sharp decline, and it
Mm.
keeps declining. Yes.
Wow.
So it's not as if women that are 35 or over and
Cannot.
cannot try with their own eggs, but like the
Mm.
doctor told her, chances of success are lower. Yes, chances of success are lower. And then, we've also seen some that are not even up to that age of
Age.
35, but ovarian function, ovarian reserve is low. So there are
Hmm.
lots why ovarian reserve can be. And
Mm.
the commonest reason is something we call idiopathic. The
Okay.
cause is unknown. In about
Unknown
50 to 75% of women that have low ovarian young age, what we call
age.
premature ovarian insufficiency. It's not the time for the ovarian function to have declined, but
Yes.
before time it has declined. The
Wow.
cause cannot really be found. Some of
Hmm.
it is related to genetic factors and so on. So even a young woman, you could have someone below the age of 35
Hmm.
with low ovarian reserve.
Wow.
Yeah, but there are some pathologies that can bring about a rapid decline in ovarian reserve.
Oh,
Yes.
okay.
For example, people that have endometriosis that affects,
Hmm.
damages the
Okay.
ovary. If
Hmm.
you've had cancer of the ovarian cancer, that damages the ovary, or if the ovaries were even removed,
Wow. Hmm.
torsion of the ovary, cyst,
Hmm.
that the part of the ovarian tissue was removed. All that can lead to, diminished ovarian reserve, even in a
Yes.
young woman.
Woman.
Yes.
Wow.
And
Hmm.
then people that have had to have therapy for cancer, maybe chemotherapy, radiation therapy, all that can damage the ovaries.
Hmm.
Yes, so it's not just so some disease conditions could lead to it. Even genetic conditions, some conditions that are genetic, like some women that have what we call Turner syndrome. So the ovaries, this is something, a congenital abnormality that happens from birth. So the ovary doesn't develop as it should. So they have,
Yeah.
diminished ovarian reserve. Yes.
Wow.
And then even some conditions such as autoimmune diseases, thyroiditis, even some people that have type 1 diabetes mellitus, all this can lead to a reduction in ovarian reserve. So
Reserve. Wow.
sometimes it's not just age related, but the
Hmm.
common natural thing we know is age. As a
Age.
woman ages,
Hmm.
ovarian function declines and then ovarian reserve declines. So the chances of getting healthy, good eggs from this woman also reduces.
Wow.
Yeah, and that's why you see us preaching about oocyte freezing nowadays.
Freezing.
Yes, because we know
Hmm.
with our society, the complex women nowadays, a lot of women wanting to achieve their career, educational dreams.
Yeah.
So you see ladies marrying much later. And then even then, a woman will marry herself, she wants to
Yes.
come. And
Exactly.
like they say, it's like if the men don't want to marry again. I don't know
You want to make
how
it.
true exactly.
You want to make
Society
it.
is so complex now. So
Hmm.
we tell young ladies, you mustn't wait until your ovarian function starts to decline. Your
Hmm.
eggs can be frozen and stored for future use. Yes, so
Well, so sadly, in our own case, I'm sure even with your experience over time, there are some people that have been stubborn to say they want to try. They're over
yeah,
35
we
and they
allow
actually
them to.
succeeded.
Yes,
So they
it's
still could stand a
yes, you
chance.
counsel them appropriately and they make their informed decisions.
Mm.
Yes,
Well,
yes,
in her own case, sadly, she was not among those
that
lucky people
succeeded.
that would
Yeah.
succeed over
Mm.
35 with their eggs. So she said, eventually, now she gave herself a little time because it took her some time to heal from the
This must
failure.
have been a
I
double.
mean,
Imagine after
yes,
waiting and then
for
what
so
the
long.
ray of hope that we thought, and then
Yes, yeah.
also failing. Yeah.
Wow. I wonder with this one this way because now she eventually she gave herself a year before she tried. How long do you think people could actually try after a failed IVF? Because I guess it took her time to really get. Probably this was her first IVF
Yeah.
and she was really hopeful.
Yeah. So people can try it an individualized thing.
Okay.
As it before you go into an IVF.
Mm.
Yeah. But if you're looking at the aspects of it, once you've seen one normal menses, after you can try again. But
Mm.
or once a whole client. So we usually say they should take off time to heal from that failure. Yeah, it takes some healing. So it depends. 1 2 months after a previous failure, you could always try.
Try.
Yeah.
Well, so you don't have to stay for
For
so
so long,
long
no, you don't have to
because
stay for
the
so long.
earlier the better actually.
Exactly. Yeah.
Okay, so she said that night when she did the test that she broke down in tears and
Mm.
she felt like she had failed, that she whispered and told her they are just finding a new way. Apparently she was now trying to come to terms with the fact that she
Failure.
has failed using her own
Yes.
eggs, and then they might have to give it a try with donor eggs. At that point, yes, so I wouldn't talk so long time. Slowly the grief made room for something else. So she came off the grief and accepted. So she, in fact, she made, maybe we'll talk a bit about it, because she also made some findings about the fact that even if someone is using donor eggs, it's not, the baby is not totally a stranger to the woman herself carrying the baby. She said she also realized that motherhood wasn't about matching DNA, because a lot of people feel like
Yeah.
once I'm
It's
using
not,
donor egg, is
yeah.
as good as the baby is not
Not
mine.
mine.
She
Yeah.
said it was about love and life that she would pour into the child. Apparently, she was going to carry the pregnancy. So
Yeah.
this was some, I think in Moji's case now, she practically had to work herself
Into
into
accepting,
accepting it. Yes,
yes,
that's
which is
something that I
important.
think you should
Yes.
really talk about, because
Yeah.
a lot of women struggle to
With us
come to the terms of
terms, yeah,
accepting donor
they
egg.
grieve, they, there's
Yes.
this grieving that,
Mm.
you don't get to be the one providing all, using your own garments, your own eggs. Yes.
Yes.
So a lot of people grieve. It's natural to grieve, any woman will want
Mm.
to grieve. But then, like Moji did, she came to terms with it. She armed herself with knowledge. That
Mm.
knowledge told her she will carry this baby. You
Yes.
carrying the baby, you get the chance to bond with this
With the
baby, to
baby.
connect with this baby. And science has also shown that while the baby is being nurtured in your womb, there's some genetic transfer between you and the
Wow.
baby. Yes.
Oh, okay.
So, this is an added advantage beyond, because some people ask, what's the difference between this and adoption?
Mm,
No, those are
exactly.
the added advantage. You get
Mm.
to nurture this baby, carry this baby in your womb, bond with this baby,
Baby.
and there's still some genetic transfer. This baby
Mm.
still has some of your genes. So knowledge, and that's what knowledge does. In our
Mm.
culture, our cultural beliefs, our religious beliefs, other beliefs, people just blind themselves. I know
With
they don't arm themselves with knowledge, or
knowledge.
some just
Mm.
refuse, to accept, what really it is. So
Yes.
knowledge brings about light. When you arm yourself with knowledge, which is what Moji
Mm.
did, she saw a way out. She saw that, oh, this thing is not all negatives or all bad.
Yes.
Yes, I still
Yes.
get to be a part of the process.
Process.
Yes.
Mm.
So I think the knowledge part,
this is
information, is
this is
very
a part,
important.
and another thing that makes women struggle to come to terms is because a lot of people do not talk about it when they do IVF with donor
Good.
eggs.
Yeah.
You have a
There's
lot of
still a lot
people
of
concealing,
secrecy
yes,
about
and
it.
all
A lot of
that. It
people,
takes a
yes.
few people to open up.
Yeah, and because you don't sometimes you don't blame them because of
Yeah,
the environment we
we
find
find
ourselves in.
ourselves.
Yeah, so that these children are not labeled and all that.
Yeah,
Yes,
that's
and
right.
yes, so a
That's
lot of
right.
people still consider it.
So I also think that those people that, some people will even use donor egg and then they will badmouth it for someone, so they don't even, like, they practically had to achieve pregnancy with donor egg, but then now when they are counseling someone, they
Mhm.
now still want the person to try with their own egg and then shut the person away from even coming to terms with donor egg. I
Yeah,
think that's even wickedness,
that is
because I
wickedness.
can't
Yeah,
understand why
because you don't
you
have to
accept.
open up about what you
Yeah.
did. It's private to you and your
Yes.
husband, or private to you. You mustn't share, but you could point the person in the right direction and say, be open to whatever counsel you're giving.
Exactly. So it's left for
Yes.
them to use the term now to
Yes, to
decide.
decide.
You really
Yes.
don't have to tell them
Don't do
say
this,
and
don't do
all
that.
that.
When you
Yes,
know,
yeah.
yeah.
You really, and yes, I know that you could have some people that would further probe and say, was it your egg you used or donor egg? I know it's also difficult to answer that kind of
Mm.
question when you want to keep it. So from there you might have some women saying it was my egg, and then they
Uh,
just at that
yeah.
point, because you can have people, I don't know if those
Face
people that
face
want to
up, straight people that want to
probe
pry.
much, and
Yes,
yeah,
they just
they're asking
blunt
questions
and
like that.
asking you,
Yes, at
yeah.
that point,
But that's information, and
yes, it's not
you should
something
not
that
be
I think people
coerced
should
to
easily just
share
ask
share.
that.
Yes.
Yes, shouldn't be coerced to ask. You can easily say,
The
I
details of
really
my I
don't,
want to
yes,
keep my
I would
details of my
rather keep
parent
it confidential. So you leave them blank.
private.
Let them think
Yes.
whatever they want to
Want
think
to
in
do,
their mind. is
yes.
It's left for them to
Yeah, I
decide. But
want to keep it private, but I was open to the counsel my doctors gave me.
give
So when you
exactly
go, be open to whatever counsel you're
counsel they
going.
give
Whatever
exactly.
counsel you're giving, you can still go and
Mm.
research, Google about it and read more
Yeah.
on it.
Mm.
Yes.
So even not long ago, about, let's say, about 6 or 7 months ago, I know of someone that a friend of hers had, I think, tried to use IVF. She done, in fact, in her own case, she was even young, but She had to deal with PCOS,
Good.
stimulated multiple
Yeah.
times, for poor quality of
Of
eggs,
eggs, yeah.
and then she had to come to the terms of accepting donor egg, which eventually she achieved pregnancies. So I think a friend of hers in the same shoe, and it was difficult for that one to come to terms. She
With
had
it.
bad conditions. That's okay. You can apparently see that her ovaries are really affected
And I'm
by
sure age too.
yeah. I think she was even still less than 35, but
Okay.
she had some conditions that had affected her ovaries as
Ovaries.
well.
Okay.
So I think that her friend really gracious to even open up to her,
Oh,
because
she did.
she because I think she saw her doctor and he gave her some counsel that okay, with all this you've had failures. That's now this new friend talking that she has had failures and he had counseled her to this donor egg, but she was struggling to come to terms with using
Mm.
donor egg. So that her friend that eventually succeeded with donor egg had to counsel her, okay, I've been through that part. I actually tried this. I tried it multiple times. You're not alone in this.
Hmm.
That was even a very good friend that actually could
Yeah,
open up
yeah,
to her friend.
yeah.
So in a way, when she opened up to her friend, it now gave room for the friend to start thinking that okay, I'm not alone in this
Exactly. My friend
and all
could go
that.
this way. I can
Exactly.
go
She
this
said
way
she had, in
too.
fact, she said her friend had even told her that she has never opened up to someone, but
Hmm.
because of the way she's seen that she's trying to try the part of I don't want
What
to
to do?
use donor eggs and
Yeah,
all. She had to open
open
up
up to
and
her.
let her know that she's not alone in this.
Yeah,
She should try. I think this is a part that people probably embrace. I know some of them would worry, the donor, you don't know something about them,
yeah,
you don't know
yeah,
their lineage and all of
yeah,
that.
yeah,
But I think it's something that people should actually embrace. Well, let's come back to
yeah.
Moji.
And the donors are screened. They go through a lot of checks
mm,
and all that. And people bring their personal donors. That's
wow.
yes.
Okay.
People bring their personal donors. We've seen people bringing their sisters
Wow.
to donate for them and so on.
Oh,
So
wow.
yes,
Wow.
so ways that the donors are
Could be.
gotten. Yeah.
Okay, so she said after fast forward to the IVF with donor egg. She said after the transfer, she held her husband's hand. She whispered to the embryo inside her, "Stay, I already love you." Oh God, that's emotional. Well, yes, well as much as yes, it might sound as
But
really
it just showed her
emotional.
growth
Yes,
process.
exactly. She
Her
said,
growth
"I
process
already
as
love you, regardless of the fact that you're
exactly.
not my egg.
Yeah.
Even though you're my husband's sperm, I already love you." That
Love
was
you.
what she said. Well, that's a very warm way to welcome them.
Yeah.
Maybe you, dear viewers, I think you can grab that line for those people that would actually access IVF with donor eggs.
Right.
I think you could actually grab that line. That's a very warm. I'm actually just for the first time.
I'm
So she
hearing this for
said,
the first time.
for a woman who had waited for years, those few minutes felt like a lifetime change and miracle. At this point, I think she was really hopeful because she felt
Yeah.
like she had tried with hers and it failed.
Yeah.
So she
So
was more hopeful. Well, I think you should talk a bit because people might
donor
also
eggs
think yes,
IVF
exactly. It's
means
automatic that
100%
it's success
success.
because talking now with a bit more confidence because she
Confidence.
felt like
Yes.
she taking the doctor's counsel and she's doing
Exactly. She had
something
taken the
different.
doctor's
Yeah.
counsel and then yeah.
So maybe you should talk a bit about it because people feel once they take the doctor's counsel and they do whatever it is they do, it's automatic. It's supposed to, and you have a lot of people that can come back at you when it doesn't
You
work.
counseled me
And
for
you did
this. I did
everything
what
you
you
asked.
counseled. I did
Yeah,
everything. No, those
yes.
are just the terminologies they use. Doctor, I did everything you said I should do. So
Mm,
like we've said, so IVF using donor eggs, like you said, is not 100%. It just increased the chance further because for pregnancy to happen, it's not just the eggs. There are other factors. You have the
mm,
sperm, you have the lining, you have the uterine environment, you have the whole body environment, and all that. So
mm,
there's a lot to the process for
mm.
implantation and pregnancy to
Exactly.
happen. But if you tell that, donor eggs will give you a better shot at success. So it's just that chance. But other factors are still involved. Yes. Yeah.
Okay, so back to mood. So she said, well, okay, had the 2 years wait after so many years. That's the 2 weeks wait for pregnancy
Pregnancy,
test.
that will be
So
the
she
longest wait of our life.
she said she
Anyway, shall
was
it will be
so
the longest after waiting? You would think after waiting for years,
yes,
but it's
honestly,
not
but
easy.
still yes,
Just two
because
weeks.
so so she said she was so scared to hope, like, but she couldn't stop, even though
Yeah,
she was like, what
it's
if
not a good
I
place to be in.
I can
I
imagine.
really
Maybe you should talk a bit about what women should really do at this waiting period because a lot
just
of
live
them
your
are,
normal life.
oh
Don't
goodness.
focus on it. Don't
Mm.
even think about. Just live your normal life. Make yourself happy. Go about your normal activities. Some people will be asking you, should we be lying down with our legs up?
Oh my
Should we be in bed
goodness.
all day? No.
Mm.
Go about your normal life. Remove your mind from it. I know it's
From
not
it.
easy, but just get on with your life.
Mm.
You know.
In fact, somebody asked, what should I do for me not to think whether it will succeed or
You're
it will
not.
fail?
That's
And
why
I'm
living
like,
your normal. Get busy.
yeah,
Yeah, that will help to distract you
keep
and remove it. That's
keep
just the
keep
best.
yourself happy.
Yeah,
Avoid people that
yeah,
will make
yeah.
you easily worked up and all that. Just to be happy and eat what you like.
Those asking, can we eat this? Can we not eat it? Eat
Okay.
whatever you want to eat, please.
Please. Okay. So she said, on test day, her hands trembled too much to hold the pregnancy
She could
strip.
even do. So many people have said,
That
doctor, I couldn't do the
good.
test at home.
Oh
Oh, I
my
couldn't do
goodness.
it.
Eventually, her husband even had to help her.
Yeah,
And then,
imagine.
apparently, she even threw her face because it was her husband that told her that you're pregnant. And so apparently, even after that,
Even
she
to
was so,
look
oh my,
at.
she couldn't stand. Apparently, what, she has really been traumatized. I can imagine the
No, she
number
has gone
of
through
pregnancy tests that she has done.
negative
This, oh
pregnancy
my goodness.
tests.
So she couldn't just imagine not seeing. Oh my goodness, I can really imagine what she had to
Yeah.
deal with. So she said she collapsed into his arms and she was crying and like, okay, after so many years, that moment, I know, if it's too good to be true, am I really
Yeah.
pregnant and all
Yeah, you
that?
think you're dreaming.
Well, so far, well, she just talked about having to get to the point. She was filled with gratitude. Of course, she was happy, had to felt very, all the flutters, kicks and all
Hmm.
that of the baby. And she said at 38 weeks she was delivered of a healthy baby boy. She said his name is Elias.
Elias.
Oh well, maybe if we're seeing her in person right now, we'll ask her what the meaning of
No,
Elias
Elias is
really means. But she said, the moment the nurse placed him in her arms, she whispered, "You are mine." Oh my
yeah,
goodness. That's so warm because,
yeah,
of course, she had nurtured this baby in her womb.
yeah,
It's something that I think a lot of I've also heard someone saying that I don't even know how to react towards the baby,
yeah. I've
knowing that
heard
it's
that too.
donor
I've heard.
egg
In fact, I have
and all of
a
that.
story that just comes to my mind
Yeah.
immediately. She was wondering how she would. She was always saying, "Doctor, I don't know. Will I be able to accept this
Hmm.
child? Will I be able to welcome
Hmm.
this baby?" If
Hmm.
you see her and that baby now,
That baby is practically
forget when they
alive.
put that child in your
Into,
arms, the
yes.
emotions,
I
will
know.
just come. Don't worry
Hmm.
about you accepting this baby. That acceptance comes, that
Comes, it just
natural bond
naturally
just
happens.
comes. Yes, yes,
Once you find yourself pregnant, there's
mm,
just this spirit of motherhood that
yes,
engulfs you,
yeah,
that you just, everything, you're practically living for the child or the babies. You
yeah,
practically don't want anything regardless of whether, even for women that even do donor egg, donor sperm, I mean, there's no connection between them and their husband, but still
yes.
you see the way they nurture this baby so
Babies,
much,
yeah.
and you're just like, I mean, you would want that the miracle that,
Nurture
considering,
adopted children. So more so a
yeah,
child you carried in your womb. Why wouldn't
and
you
all
want to
that.
nurture that baby? Well, I've not seen any case of problems with bonding with the child. I've
Child.
not seen any case
So
of
for a
that.
woman out there, maybe what's your counsel to a woman out there that is still struggling to come to terms with accepting donors? Because I know there are still a lot of women that find it difficult to
Yeah.
actually accept
Yeah.
it.
So when life stares you in the face, you just face it headlong. Mother wants to, you want to have to have used your own eggs. But if
Mm,
circumstances beyond your control, maybe disease, age,
yeah,
different things came up, and that is the option your fertility specialist is suggesting to you. No, I think it's in your best interest to think about it and look at it again. Like we've explained, you still get to carry the baby. We've talked about
baby
the
gets.
bonding that happens when that baby is in your womb. We talked about the genetic transfer. So the
Mm,
baby still gets
a
things from
bit
you.
of
And you know that
you.
it's not just a function of nature, but also of nurture. So
Yeah.
it's the environment in which child is brought up, what
Mm,
values you pass on to this child, that
mm,
this child will represent. Lots of
yes.
studies have been done. People born in born in different and then placed in another environment, to show that environment even plays a
Matter
larger role
role.
than nature
Yes.
on these children. So you still get to play a very, very active role in the life of this child. So I don't think there's anything to be ashamed of. There's
Oh,
nothing to be to be afraid of.
yes.
If we look at the Bible, we see that Mary was like surrogate,
Exactly. That's what.
Jesus,
Yes.
because Jesus
Yes.
didn't have any genes from
Yes.
Mary or
Exactly.
her husband,
Immaculate
but he
conception.
was her son too. Yes,
Yes.
so it's the same
And she
thing, and
cared
yeah,
for
it's
him
not
so
something God
much.
frowns out, because a
Exactly.
lot of people feel that God. We even see
Mm.
that example in the life
Yes.
of Jesus.
Exactly.
Yes,
Mm.
so if that's the way your fertility journey is going to go, please open
Be
your heart to
open to
accept it.
it.
Yeah, be open to it. That's
So
just my
viewers,
counsel. Yeah.
viewers, you've heard that from Dr. Deborah. You couldn't have gotten a better counsel than this. This is coming from someone that has experienced over years with thousands of clients that are actually dealing with fertility.
Yeah.
And so she has also told you that she has not even seen anyone that's actually had to struggle with bonding with the baby. This is to tell you that once you have the opportunity to nurture this baby in your womb, it's a blessing, it's a miracle. It's better to have than to have. They say a, how do they say it now? A stitch in time save. Imagine
Yeah.
that you keep saying you want to use your egg and you're not achieving pregnancy.
Mm.
There's no one to hold in your hand. But trying with donor egg, you can achieve pregnancy and then you have one to hold on to.
Yeah.
While you keep trusting for any miracle that you are hoping to happen. But at least you have something to hold on to. And the earlier you embrace this, the better. So you're able to be young enough to take care of your children and not accepting it
Yeah.
at a very, very
Yeah.
advanced age where
Yes.
even to take care of yourself is a problem. How
Problem.
much more now taking care of a newborn? Because
Yeah.
it's a
That's so
very
true.
tasking
That's so true.
thing
Yeah,
to
because
do.
a lot of people accept it later down the line,
Mm.
So that's a very valid point.
So
Accept it while you're still young,
yes, and
viral,
strong,
strong,
yes, and
to,
yes,
give a lot to
exactly.
these children. Yeah.
Full of energy and
Yes.
all that, you transmit that energy into caring for these children. As long as you can care for your brother's children, for your
Mhm.
sister's
Yeah.
children, stops you from caring for a child conceived. That's your brother's child. It's not you. No
Mm.
matter how you think of it, it's your child. But this one now, it's you that carries this baby in your womb. It's in fact this is a lot more. I think
Even
for
that don't carry the baby, there's
yes,
still this bonding. As long
yes,
as
exactly.
once that
Imagine
child is placed in your arms, the
exactly. I
bonding
mean, there are
starts.
some people that even do surrogacy with all this, and then you still see them bond. How much more if you
Lots,
now have the
really bonding.
opportunity
Yeah.
to nurture this baby
Yeah.
in you? That's an added advantage. So
Yes.
please, let's be open to cancer and let's embrace this technology because a lot of donor egg IVF is actually what is even done the most times because a lot of people they come to access IVF are people that are already advanced in age.
Yeah.
Now it's become at least it's good that people are becoming more knowledgeable, so they are trying to embrace this technology at a young age. But still, you still have a large population of advanced people, so you have a lot of them still come for this technology. So I think it's something that for viewers watching, you might that's going through all this. Please let them watch this video. Send this as many people as you can so that they are well enlightened and you're open to count. Yes, we'll be happy if you can achieve IVF with your own eggs. But if you do not have the opportunity, embrace the opportunity that is open to you so you're able to achieve your dreams of parenthood. It's been amazing having you, dear viewers, stay with us today. Thank you so much for engaging us. I see a lot of you watching. Thank you so much. You cannot call all names. The list is endless, but we see you all. We appreciate you guys. Continue to your screen, continue to look out for our notification on our various videos, informations we have for you. We look forward to seeing you on our next even more of you. Have a lovely weekend. Bye for now.